If there was more time in that match as well. Morena will be back with more sports a little bit later. Let's turn our attention back to COP28, and climate change is fueling new epidemics around the world. Those are the findings of the Climate Change and Epidemics 2023 COP28 report. It's found that countries in the global south especially are suffering the most health impacts from climate change. It's despite contributing less than 10% of greenhouse gas emissions. Well, over in Dubai at the moment as well is Professor Tulio de Oliveira. You'll know, of course, from the Center for Epidemic Response and Innovation at Stellenbosch University. Prof, good to have you on eNCA all the way from Dubai. At the moment, you're obviously watching COP28 very, very carefully. I want to get a sense from you then. Climate change is now a health crisis. Tell me why. Good morning.
Good morning, and good morning to all your viewers. Yeah, so it was the first ever health day in the COP, in the climate conference. Why that? Because it's become quite clear that the climate change is really fueling an epidemic of health threats against humans. And we have three main categories. The first one is heat stroke, when temperatures increase. Imagine manual laborers working in very high temperature. The second one is mental health. People get very anxious about climate change. And the third one that we work very close is fueling epidemics. In the last few years, climate change has been fueling multiple epidemics, and very sad that this is concentrated in the global south, and that is the region of the world that had contributed the last. It's least prepared, and is the one not being affected by climate change, but new epidemics.
I see that there's a big focus at the moment, especially around malaria, Professor, because you mentioned the heat waves. As you'll know, you're ordinarily living in South Africa. You're in Dubai right now, which is hot at the best of times. South Africa, though, experiencing very high temperatures. Then we've got the new weather phenomenons as well, which is bringing more rain, especially in Central Africa, Southern Africa. And with that comes malaria as well. And I want to call it an epidemic, because that would be the only way to describe it, isn't it?
Yes. So 2 days ago, the World Health Organization released the malaria report and showed that malaria is back increasing. Not only increasing, but is the spread. It is increasing. The areas is going both to south, in the case, like example, South Africa, but also to the northern hemisphere. And as you talk, you also have big epidemics that's caused by viruses transmitted by mosquito. This year, over 5 million people were infected with dengue. And in the last few months, we have described multiple new strains or variants of chikungunya virus that is kind of leaving the sylvatic cycle. This means being transmitted just in forests, to start entering the urban environment. In addition to that, and people in South Africa will know about that, extreme climate events can also fuel other epidemics like cholera. We had the worst cholera season of the history of Africa in the last year.
So when we start talking about the solutions to this, though, this is going to be a wildly unfair and loaded question, Prof, because climate change is nothing new. It is a focus at COP28. We've identified the problems. What do you imagine needs to be done about this, though? I mean, obviously we can't change the climate overnight, but from a medical side, from your world, what can be done to mitigate all of this?
Okay, thank you. That's exactly why we got a space on the table of COP28. So yesterday we released a global report that was written by hundreds of scientists. This report and this program is led by South Africa together with Brazil, the global south, that not only identify the problems, but also provide a call for action for solutions. And we have identified 5 main factors that can help to decrease the effect of epidemics due to climate change. The first one is report outbreaks quickly. And as you know, sometimes not easy. You may remember what happened with South Africa of the Omicron. But by releasing outbreaks quick, that's what we can act. The second main action, it is to increase genomic surveillance. We need to know what is the variants of viruses bacteria and parasites that are circulating to make sure that the vaccines and therapeutics are effective. The third one is prioritize a vulnerable population. And fourth one, promote climate resilience. We have to be prepared when epidemics come. And the 51 is that what we are doing today is the finance day of the COP, is really that they have to increase sustainable funding for response to epidemics. And so important for South Africa and for us to have a seat on the table to really push to exactly not only highlight the epidemics, but also come with solutions.
Just very quickly on the finance side of it, Prof, here in South Africa, I know you're in Dubai at the moment, but often we speak to you here in SA. What can South Africa do about this? Let's just come back to where we are at the moment.
Okay, so South Africa has invested in science and innovation. As you remember, we did quite well during the COVID pandemic, and all that big investment that was done in South Africa by Department of Science Innovation, Medical Research Council, now can be used to pivot to the climate disease. So that's what we are doing. And that's why we have launched this big climate consortium. But this is not enough. But what we are also doing is engaging with international funders, such as the World Bank, the Rockefeller Foundation, and other private foundations to increase the pot of funding so we can support not only epidemics in South Africa, but also in Africa. Our center is a training center for the African continent, as recognized by the Africa CDC and the WHO. And in the last 3 years alone, we received 400 fellows from 52 African countries that we try to train on how to respond and characterize epidemics.
Oh, Professor, it sounds like the plans are in place. This is why you're over at COP28, as you say, Professor Tulio de Oliveira, at the seat of COP28 as well. Such an important discussion, but you've got to bring it back home as well, because you talk about these global pandemics, these global issues like global warming. But what do we do here in South Africa to try and improve that? My biggest thanks to Professor Tulio de Oliveira, a very busy man at the moment, Director for the Centre for Epidemic Response and Innovation. You'll know him, of course, during the COVID pandemic. Now the focus at COP28 is the global pandemics as a result of global warming. It's almost 8 o'clock. We're back with you in just a moment.